Go ahead, Dr. Albino. Just test it. Let's wait for a few more people to join us. So wait for a few more people to join us.
Erasmus. Hello.
Yes, Doc.
Yeah. So there is I'm going to try and launch the Q&A so that the audience can at least engage in that as we wait for more people to join.
Wait for a few more people to join us.
Yeah, we have about 25 people online. Hello. I think, yeah.
Yes, Doc.
Yeah. So there is I'm going to try and launch the Q&A so that the audience can at least engage in that as we wait for more people to join.
Wait for a few more people to join us.
Yeah, we have about 25 people online. Hello. I think, yeah.
Yes, Doc.
Yeah. So there is
Dr. Cornell, you can proceed. In the meantime, as set up, you can just give a bit of introductory remarks. So, good evening, everyone. My name is Erasmus Okello, one of the moderators of today's talk. My co-moderator is Dr. Sendagire. We both anesthesiologists and intensivists, and we both lecture at Makerere University, the Department of Anesthesia and Intensive Care. Today, we handle the third segment of our chats on cardiovascular medicine in the ICU. We started with aspects to do with applied physiology. Then we went on to discussing fluids in the ICU. And then we came down now to discussing, today we shall be handling stuff to do with vasopressors and inotropes in the ICU. We have a packed day, and we shall be able to get through it quite quickly. We shall have, and like usual, as usual, we shall have clinical cases presented. Today we have 2 clinical cases presented by residents in the departments of anesthesia. There's a bit of a twist to it. And then we shall have a talk on the physiological approach to use of vasopressors in really the clinical trials that have informed So along with that, we eventually closed the day with a discussion on how to limit the use of vasopressors. Yes, they are very useful. Yes, they make a difference, and they actually help prolong lives of patients to the that we are able to be of impact to their long-term patient-centered outcomes through other therapies. However, use of these drugs also for a long time has got its own negative side, which we shall learn about today. And so we are going to learn the alternatives, the adjuncts, the interventions, the tricks that help us support our patients, sometimes with or without addition of catecholamines in them. So before we get the core of the talk, as usual, we shall have a poll questions. And I'm going to hand over to Dr. Cornelius to run that for us before we invite the first speaker. So in the meantime, I'm going to introduce the first speaker. Our first presentation will be, as you mentioned before, we have a few objectives that underpin our conversations. Particularly today, we want to understand the approach to management of shock states, especially in relation to the supportive cardiovascular pharmacotherapy, helps support our patients in the ICU. And these are the speakers of the day, as I mentioned. So our first presenter is Dr. Albina Musitwa, a resident in our department, and he will be taking us through a clinical case. So I'm going to pull down our screen and have Dr. Musitwa put up his screen while we run through the poll question. Once we are done with the poll questions, Dr. Cornelius will introduce Dr. Musitwa and allow him to go ahead and present. Thank you. Dr. Cornelius, over to you. Cardiovascular pharmacotherapy helps support our patients in the ICU. And these are the speakers of the day, as they mentioned. So our first presenter is Dr. Albina Musitwa, a resident in our department, and he will be taking us through a clinical case. So I'm going to pull down our screen and have Dr. Musitwa put up his screen while we run through the poll question. Once we are done with the poll questions, Dr. Cornelius will introduce Dr. Musitwa and allow him to go ahead and present. Thank you. Dr. Cornelius, over to you.
All right. Thank you, Dr. Erasmus.
Therapy helps support our patients in the ICU. And these are the speakers of the day, as they mentioned. So our first presenter is Dr. Albina Musitwa, a resident in our department, and he will be taking us through a clinical case. So I'm going to pull down our screen and have Dr. Musitwa put up his screen.
Dr. Erasmus, can you hear me?
Yes, I can hear you, Cornel. Please proceed.
All right. I've just been having some issues on my side here with your voice kept replaying everything you've been saying over and over again. I think now it's fine. All right. So the poll question the poll quiz that I've put up, I'll be closing it in about a minute. It's pretty easy. Just respond to the questions, and then partly the questions are for us to understand, to know how much the audience is aware about shock states and use of vasoactive agents. Dr. Erasmus, can you hear me?
Yes, I can hear you, Cornel. Please proceed. For some reason, our sound keeps replaying. We're just going to sort that out in a bit. So kindly just proceed with the poll questions as we sort out our sound.
All right, I'm going to end the poll in about 15 seconds.
For some reason, our sound keeps replaying. We're just going to sort that out in a bit. So kindly just proceed with the poll questions as we sort out our sound.
Okay, the poll questions have been closed for now since we had more than 50% of the audience. Unfortunately, I do not know if we have been able to fix the sound issues. So my hope is that you won't be hearing my voice replay again and again. So I think we can ask Dr. Albino. Let's see if he's online. It seems I don't see him anymore. We can ask him to rejoin.
Dr. Cornelius, perhaps we could start with the second presenter. The second presenter is Dr. Joshua Muhangozi. He is a resident in the Department of Anesthesia and Intensive Care at Mbarara University. He's in year 3. He will be taking us through one of the clinical cases of the day. Thank
you. Erasmus, I can't see Joshua unless he's Josh. I don't know. I can't see him on among the audience unless it's Joshua Luvega or Joshua Montevi or if he's a Joshua. He's not one of them. I can't see him.
Dr. Cornelius, perhaps we could.
Oh, MJ, I've seen him. I've seen him. He has put up his hand. Okay.
The second presenter is Dr. Joshua Muhangozi. He is a resident in the Department of Anesthesia and Intensive Care.
Joshua, please share your slides. Erasmus, I can't see Joshua unless you.
Yes, good evening, Dr. Cornell. I'm around. Let me see if I can get my slides on.